should I contact if I notice blood in my pee?
If you notice blood in your pee, you should take it seriously and you should definitely contact your GP. It's very important to take blood in the pee or the urine seriously because there is a chance that it may be something sinister causing that.
Will I be okay if it goes away after a couple of days?
I think the temptation is to assume that if it comes and it goes, it's safe, but actually just one episode of blood in the urine is and should be taken seriously, and I would attend your GP if you did have an episode of blood in your urine.
What is the process if my doctor wants me to go for further checkups?
So I think once you have seen your GP and he and you have had a chat about the fact that you've had blood in your urine, you may not be having it actually when you see your GP, but he would still like to see you because there are some tests that need to be done to potentially investigate further the cause of blood in the urine. And there are special clinics taking place in lots of hospitals around the country further investigating blood in the urine, and this can involve simple blood tests, urine tests of course, also x-rays, and potentially even putting a tube into the bladder to find out the cause.
What happens if they find it's cancerous?
So one of the possibilities of having blood in the urine is a cancer diagnosis, and that could be bladder cancer, it could be kidney cancer, could even be prostate cancer, and there are lots of other causes as well, infection, trauma, but the key to this is that we need to make sure it's not something sinister, and if it was a cancer we would like to identify it as early as possible. And the reason why we are keen to identify cancers early is if you identify cancers early or before they've spread, often they can be just treated with local treatments. For example, an early bladder cancer could be treated just by scraping the area away, or a local kidney cancer could be treated by just removing part of the kidney. But if the cancer's spread, then treatment is more focused on chemotherapy, radiation therapy, and is much more intense. So the earlier we identify these cancers, the better for patients. And one of the things I think that's different between us and some of our American and European partners is that patients in these other countries, I think, probably present to their GPs with blood in their urine earlier, which means they're easier to treat at an earlier stage and the outcome is better. So the key message really is if you do have blood in your urine, take it seriously. If it is a cancer, which it may or may not be, we can identify it early and make sure it doesn't come back in the future.
Can I get better without surgery?
So many patients who have blood in their urine are subsequently found to have an abnormality in one of their kidneys, or the kidney cancer is identified in a routine scan, and that might or might not be within the context of having blood in the pee previously. One of the questions then is, what is the treatment, and do all patients need to have an operation? And the answer to that is no. There are a group of patients in whom have very small abnormalities that we can watch. There are some abnormalities that may or may not be cancer, and we need to go in and biopsy those to confirm the diagnosis. And if it's not a cancer, we can obviously observe those as well. And then there's a third group of patients where sometimes we can freeze or cut off a blood supply to the cancer if they're small enough, and therefore we can prevent the need for an operation. However, if you have a kidney mass that's well defined on a scan, the standard treatment would be to have that surgically removed.
What happens if it's serious?
Kidney cancer can present many different ways. It can present as a very small mass, which we can identify on a CT scan, a bigger mass causing symptoms like blood in the pee, or even it can be more serious and can spread to other areas, such as the lungs, the lymph nodes, or even the bone. As the cancer progresses and spreads, the cancer becomes more difficult to treat. And that's one of the reasons why we think identifying cancers early is very, very important, and why if you do have an episode of blood in the pee, it should be taken seriously. If the cancer has spread to other areas, we have a host of new therapies designed to treat the whole body, and they target blood vessels and target cancer cells directly. And one of the key messages to that is that this field of kidney cancer is moving quickly, new treatments are becoming more effective, and we hope in the medium and long term that we can cure patients even if the cancer has spread beyond the kidney.
If they remove the kidney, what is the process and the recovery time?
So let's assume for a second that an operation is going to take place and thousands of patients in the UK have their kidneys removed every year. If an operation is going to take place, there are different types of operation that can occur. They can either be open operations or laparoscopic, that's keyhole surgery. And we even now do robotic surgery. And there's a robotic surgery centre in London Cancer, for example, at the Royal Free Hospital, where robotic surgery is used to remove just part of the kidney. And the recovery times for these newer types of surgery are quicker than the old types. So instead of being in hospital for a week, you're in hospital for only 1 or 2 days. The operation takes about 3 hours to perform. And we like to say that the blood loss is less than half a litre, 300 millilitres, for example, a can of Coke. That sort of blood loss is what we would expect. The surgery is routine and performed regularly. Occasionally, if the cancer moves or spreads or goes into the blood vessels, the surgery becomes more complicated. And under those circumstances, often a team of surgeons, including liver surgeons or gastric surgeons, are required to make the surgery work better. So I think overall, the majority of operations are routine. We've got some new novel machines that help us with those operations, but there are some more complicated procedures that take longer to recover from and are more challenging with side effects.
What happens if it's terminal?
Specifically, if the cancer has spread beyond the kidney to other areas, such as the lungs or the lymph nodes, those patients do not tend to be cured with surgery alone, and other treatments are required. These treatments are systemic therapies. They're called VEGF-targeted therapies, such as sunitinib or pazopanib. These are the mainstay for treatment in the UK. And if these drugs fail, and they're given initially, they control the cancer, but invariably these drugs fail, usually after a period of 1 to 2 years. When these drugs fail, we move on to other drugs, which also control the cancer in a slightly different way, like everolimus or axitinib. And when those drugs fail, we then exhaust our systemic therapy opportunities. And we hope that's a period of years, but there are some patients in whom the drugs fail more quickly than that. If the drugs are to fail, there is a process where the cancer grows in different areas. And as the cancer grows, it can cause symptoms. And those symptoms include weight loss, pain, loss of appetite. And these symptoms can be quite debilitating. So kidney cancer, while we do have effective therapies to treat disease that's spread initially, those therapies currently don't cure patients. Over a period of time they fail, and when they fail, patients get cancer-related symptoms. And of course, 2,000 patients in the UK die of kidney cancer every year.
What's your overriding message for anybody who finds blood in their pee?
This Blood in the Pee campaign applies to both men and women, and it's important because we think that it will improve the outcome of patients with kidney cancer if we can diagnose these cancers early. So I urge you, if you do have an episode, go to your GP and get it sorted out. Get the peace of mind, but also if it is a cancer, it will increase the chances of us curing you in the future.